right, let's move into bones of the lower leg. So those that we will be talking about are the tibia, the fibula, and all the ones of the foot. Remember, these are not real bones. Thank goodness. Okay, so if you're following along in your actual textbook, I will be on page 289 is where I'm looking here, or I'm on the very back, page 12 of the handout here. So first thing, we have the tibia. So this is a prominent bone in your lower leg. So this is where you'll feel your shin. You can't really feel your own fibula very well. It's kind of hidden on back there. But all right, so this is a right. This is the right tibia. This is your front anterior view. So on the right, you've got this depression, or this pointy part here. And then from the back, there's the back in it. It's on this side. So here's the front for this large portion, the pointy thing. So that's the front view. From the back, there's a dip kind of in there, so that's kind of how you can tell it's the back. All right, so the book lists a whole lot of points here. We're not going to talk about that many. So again, we got to get oriented. We need the medial and the lateral side. So if this is our front, this is the medial. So again, just think about your leg. So here's my leg. So this is the medial side on the inside of my leg. Here's the lateral side. All right, so my medial condyle, these are going to be the ones up at the top. So you can see these large portions, and guess what they articulate with? The medial and the lateral condyles of the femur. Look at that. That makes a knee with a lot of tendons. So there's a knee. All right, now, so we have to have our medial side. That would be this one. So here's your medial condyle. And then here's your lateral one. From the back, it's a little bit easier to see on the back. Here's your medial, and then here's the lateral. So just make sure front, back. So on the front, medial side, lateral side, from the back. Okay, next you have your tibial tuberosity. That would be the ridge here in the front that I told you. This is what it's called. It's called the tibial tuberosity right there. That's a big point of attachment for some of your quads. And then down you have your medial malleolus. That would be this point down here. Your medial malleolus. This is going to form part of the ankle. So this point here. So from the front, you should be able to see both your tibial tuberosity and your medial malleolus, medial condyle, lateral condyle. From the back, all you can see is, make sure I get this right, medial, and lateral. Next, you have the fibula. The fibula connects not very well, actually. So it just kind of sits in here, kind of like this. So it's held on, but I don't think these are actually from the same skeleton, the same pretend skeleton. But that's how it's going to attach, and they're just kind of right there together. So you feel your shin, but the fibula is also there to provide some support. So it's like the lower limb equivalent of the radius and the ulna. So down at the bottom there in the inferior, that's going to be part of the ankle. The top's part of the knee. So like the knee is like the elbow, the ankle is like the wrist. So hopefully that helps. So the only things we need to worry about are getting oriented to the fibula. So this part up here, this is the head. And this down here, you have your lateral malleolus. Because I think, yeah, there you go. That's the lateral malleolus. Because when they're put together, yes, it's on the lateral side. So we've got them hooked together. So notice that the fibula is on the lateral side of, so yeah, here's my leg. So it's on the lateral side. So this would be the lateral malleolus. So the head, lateral malleolus, fibula. Now, let's talk about the foot. This is very similar to the hand. This is a left foot, actually. Okay. Well, so there are a total of 7 tarsals. We're going to give 2 of them names. So parts of the ankle. The ankle is formed where you have your tibia coming down, fitting in there. Your fibula coming down, fitting right in there. I don't have enough hands to put them all together, but okay. So this is, if you have the top of the ankle here, the first thing you see coming down is this bone right here, and this is the talus. So the talus is what you get first, and then you have under the talus you have the calcaneus. So these two work together to be like part of the heel. So there's the heel. So if you were to pick up your foot and kind of hit on it, that you would be hitting your calcaneus. Kind of up in here area where you have the ball of the ankle, that would be this part here, the ball of the ankle, that is the talus. And then you have 5 other tarsals. So all of these things here that form the ankle are the tarsals. Now notice you have these 2 that are larger. You have 5 other smaller ones. The rest of the foot, almost exactly like the hand. Only here you have tarsals. So the foot bones, in the hand they are metacarpals. In the foot they are metatarsals. So in the wrist you have carpals, hand metacarpals. In the foot, tarsals, metatarsals. 1, 2, 3, 4, 5. And so you can sort of feel them in your foot if you try to push on them. You can kind of feel those foot bones. Then when you get into your toes, you have your big toe, which is like your thumb, so it only has 2 phalanges. The ones that are closest to the body are going to be the proximal phalanges. There are 5 of them. 1, 2, 3, 4, 5. The middle phalanges, there are 4 because the big toe only has 2, so it does not have a middle one. So they're the ones in the middle. 2, 3, 4. And then you have your distal. There are 5 of those because the big toe comes back into play. 1, 2, 3, 4, 5. The distal one's always where the nails are, whether we're talking about the phalanges in the hand or on the foot. So that covers the remainder of the bones of the lower